students. Today we are going to learn about some hematomas. So to begin with, we will discuss about epidural hematoma, and after that we will discuss about subdural as well as subarachnoid hematoma. So first of all, let's know about what is epidural hematoma in detail. So basically, epidural, the name as it suggests that it must be on the dura mater, above the dura mater. Epi means above. Okay, so the location of this hematoma is generally between skull and dura mater. Okay, after that we will discuss about the CT scan appearance. So whenever there is a patient of epidural hematoma before you, you have a CT scan, you must witness some biconvex shadow. As you can see here, I have already mentioned it. This is a biconvex shadow. As you can see, it is a shape of lemon, more or less you can say. And what happens, what is the reason of epidural hematoma? It is because of the rupture of middle meningeal artery. Okay. Also, the most important thing which is to be remembered about this kind of hematoma is the lucid interval. As it is mentioned that this kind of hematoma is generally the result of accident, mostly the accident which is happening on the traffic and all. So for that we have to remember the lucid interval, and along with that you have to remember the period. What is basically lucid interval is loss of consciousness 1 to loss of consciousness 2. Between these two loss of consciousness, we have a period which is known as the lucid period. Okay, now you will say, what are these two consciousness phase? So there is a primary consciousness loss, which is stage 1, and then after that stage 2 occurs. Once the patient reach the loss of consciousness of step 2, there is a very less chance that the retrieval can occur. Okay, also it is mentioned that it is generally it happens in the younger age. Mostly it's not always that it's mandatory for that group of age. Okay, also because emergency situation is here, since accident is being considered, so emergency situation is a most prevalent thing in this epidural hematoma. Now we will discuss about the subdural hematoma. So basically this type of hematoma can be found between the dura mater and arachnoid. Of course the name suggests subdural means below the dura mater. So between dura mater and arachnoid, and in the CT scan you can witness the crescent shaped shadow. Also, what is the reason? The reason behind is the bridging veins rupture. So there are a lot of veins which are bridging through the dura mater and arachnoid in between them. So these veins rupture and form the subdural hematoma. Generally it is seen in the elderly patients or elderly human beings, people. The patient who get subdural hematoma generally are found to be the chronic drinker. It means they are having alcohol for a long time, and it is not always emergency until and unless many small hematoma comprise to form a large hematoma and start suppressing the brain or internal structure of brain. So until and unless it is not considered as an emergency situation, but when it becomes large, it is an emergency situation and it can be excised. Now this CT scan shows the crescent shaped shadow which you can see in the subdural hematoma. Okay, this is the crescent moon shaped shadow you can easily see here, and these two can be easily distinguishable when you see the lemon shaped. Most probably the lemon shaped you can see in the epidural hematoma, and the banana you can say. This is a kind of crescent shape, but it resembles the shape of a banana, so you can say it is present in the subdural hematoma. Okay, also there is a trick that if you remember the shape of subdural, we have B. Okay, we have B for banana, so there is a crescent shape, and also here we have P, which is pi for lemon. Lemon, we also use word pi for lemon. So here you can remember the shape of the hematoma in the CT scan. Now this is a third type of hematoma which is known as the sub-arachnoid hematoma, in which we can simply say that where this hematoma must be present. So it is present in the sub-arachnoid space, as the name here suggests. Okay, so what happens here is that we have a lot of branches of arteries from the circle of Willis. Okay, so any kind of aneurysm or any kind of rupture in these branches of circle of Willis, we have a bleeding in subarachnoid space, and that bleeding result in the formation of subarachnoid hematoma. And the important point about aneurysm is that then whenever there is any kind of congenital anomalies present inside the brain, there is a high risk of aneurysm being occur there. Okay, since the anomalies is present since birth, the aneurysm chances increases because of the weakening of the arteries and all. Okay, arterial wall and all. Also, the subarachnoid hematoma is generally seen in the younger people, and this also is an emergency situation to be checked upon immediately. So this is the CT scan of a subarachnoid hematoma. Okay, so here are all the three types of hematoma which you can learn simply. the epidural, subdural and subarachnoid hematoma. Most importantly, you need to distinguish between epidural and subdural hematoma because these two are confusing and questions are also being asked. You have to remember about the lucid interval LOC1 and LOC2. Also, you have to remember that once the patient reaches LOC2, there are very negligible chances to get back that patient alive. Okay. Perfect. You have to remember that a subdural hematoma patient must be a chronic drinker. Most probably, there are high chances that it is a chronic drinker patient case. Okay. Bridging veins rupture. So, summarizingly, we have to remember the reason, the shape, where you can recognize the type of hematoma in the CT scan, and the situation considering. So, in the accidental cases, epidural hematoma is the most famous hematoma. Okay. Thank you so much for watching. If you like the video, do hit the thumbs up, subscribe to my channel, and share to as many people as possible. Thank you so much.